Greatest thing about this is that every single patient that is on our services is actually have an individualized care plan that we tailor per their needs, and that's where we focus on with them. They're part of those decisions as well, and it is really successful care that we provide.
And we usually collaborate with the physician, of course, to kind of guide us on the treatment, and we have all kinds of services. We have therapists, physical, occupational, and speech therapy. We have nurses, dietitian, home health aide, and social workers as well.
You know, in addition to that, with our neuro rehab specialized care in the department and private duty, we also have rec therapists where we are able to take the patients actually into the activities, recreational activities, include them in communities, community activities and so on.
Spectrum Health VNA, the first thing we want to do is collaborate with the patient and the family to get that individualized care plan. You know, if their goal is to stay in the home, that's what we want to work on. If the patient's caregiver is involved, we involve them in all of the care. We can train them in different programs that they need to do. Medication reconciliation, we can teach them how to do that. If there's home modifications so that they can get into the shower, we will teach them how to do that and educate the family as well.
That's right. In the private duty cases, what we also do, we collaborate with the physicians, with clients' physicians, and you do the same thing with your population, I know. And with our case management, the way we provide the case management, it is basically we're acting as a connector, if you will, with all these different services that the client might need, which is the beautiful thing for family and clients when they don't know what to do and where to go. Beauty of this service of ours is that we have a continuum of care. From acute level care where the patients might need the acute services and going to the hospital to the connections with our ambulatory group and physicians. We deal with a lot of physicians and have connections and collaborations with that. But at-home services specifically have a realm of the services from the hospice and palliative care to the VNA services that are offered for our clients, as well as the private duty and, like we mentioned, neuro rehab services. Besides the Med Now, which is the service that Britt can talk a little bit about.
Yeah. With Med Now, we have our telemonitoring, and we primarily focus on patients who have heart failure. So our goal with that program is to make sure that they don't go back into the hospital. We keep them in their home safely and where they want to live. We also work with patients with virtual visits, and we have our physician program as well, and they visit patients through Priority Health. At VNA, we do see pediatric patients, actually neonates who are coming right out of the hospital. We see them with various issues, swallowing issues. Maybe they're not ready to take a bottle. We can work with them on that. Maybe they have some developmental issues. Again, we can have our physical therapy, work with them, or occupational therapy. And then other people who maybe are not elderly yet, but they're getting weaker and they're in home, and we can come out there and work with them on different strengthening and those kind of things.
Correct. We can also, for example, do the home evaluations. We can send the therapist to the homes where we can evaluate the home, give some suggestions, or even suggest the services that maybe a person would need. Post-surgical services, you have the surgery and you go home, but you're still weak and unable to be independent. That's where we can come in.
Another good type of patient is if your loved one is what we call wall walking, where when they're walking down the hall, they're starting to hold on to things because maybe their balance is off. That's another one we can come out and assess them. A couple other behaviors, maybe they take medications and they're in their pill box, but they're not taking it anymore. So they might not remember to take it. That's some strategies we can work on. Or if you do see forgetfulness, or if someone's had a fall, that's a very good reason to call us in, because we can adapt the environment and those kind of things.
That's correct. For example, they notice the wounds that they have, or they came from the from the hospital, have a wound that they cannot manage, or nobody in the family is available for them to help them out. Those would be all the times that you can call us without a hesitation.
For Spectrum VNA, Medicare usually covers it full. There is no cost at all. For private duty?
For private duty, we're taking all types of insurances. If we have the need where the need is actually Medicare or Medicaid, we would work together with their services to be able to see what the need is and then direct the client to the right section of our at-home programs. So yes, we would take that. For the private duty, its beauty of it too is many of our clients these days have life insurances, long-term insurances, or anything like that you would not think that could be used for as a coverage. If you call again, our 1-800 number, which is 1-844-702-HOME, we have a staff that can really help you and answer your questions. So I would not hesitate to call and ask those questions, and let us help you. Let us help you through that.
We also have a website, and it's athome.spectrumhealth.org.